Welcome to the JJ Show with myself, JJ.
And Dr. Jill.
Alright, so Dr. Jill is a dietitian/nutritionist. So, Dr. Jill, what do you do?
Well, I usually treat with people who are newly diagnosed with type 1 diabetes. I teach them how to create new meal plans, how to count carbohydrates. I record their glucose patterns, and I answer any questions they may have.
Okay, so is visiting a nutritionist a one-time thing?
No, not at all. You should visit at least every 6 months.
Why so much?
Well, it's important that you continuously visit a nutritionist because they will update you on the latest nutritional information and they can update you the new changes in your diabetes as time passes.
Okay, so obviously you have to change your diet. So would type 1 diabetics still eat the same food that they enjoy?
Of course, but you have to have an open-minded change. You should always eat well-balanced meals no matter what. As a matter of fact, we never like to force clients to say you have to completely avoid this food. We just say you need to have it less often or something like that. We never take out any, as much as we can.
So do you have any advice as to making good choices for eating?
My personal advice, a lot of my clients do, is they keep a food diary or a food journal that you record everything you eat in, every meal, every snack, breakfast, lunch, dinner. It's good to write every meal. It's also good to include numbers because you know how much of each food you eat, how many grams of fat there was included, reading food labels, stuff like that, dates, and also like recording your blood sugar levels afterwards and the emotions you may be feeling after you eat.
Okay, so let's move on to exercise. Is there a specific amount or certain exercises that are necessary?
Well, it's healthy to exercise at least once a day. However, the exercises you do depend on your glucose levels and the intensity of the exercises you're doing. Most of my clients enjoy just a walk or jog around the neighborhood or around the block.
Wait, keep the camera on me. It's my show. Okay, so what kinds of questions do you find yourself often being asked?
Well, people often ask what types of foods they can eat, how much, how many grams of carbs or fat they're allowed to take in, new ideas for breakfast, lunch, dinner, and snacks, how to reduce sodium intake, what to look for in food labels, what's beneficial about herbal supplements and alternative diets, and especially, I get this a lot, how to change the recipes they already have to compensate for their body's needs.
Oh, well, what's a typical appointment like for a first-time visitor?
For a newly diagnosed patient to come in, first we obviously have you fill out forms so we have personal information and we can assess your current health and nutritional status. We weigh you, calculate your BMI, and sometimes possibly analyze your body composition if necessary. We ask about your current physical activity patterns, review your blood work, your current eating patterns, see how much you know about diabetes, help you set goals, and come up with a meal plan that works for you. And then we'll teach you how to count your carbohydrates and answer any questions you may have.
Well, look at the time. Well, I guess it's for a commercial break. Let's head out. Get yourself a red pen. It's amazing. It's red. Yeah. And you can use this to correct mistakes, but don't use it on your siblings. And, right? Mikey agrees with me. So, call this number right now to get yourself a red pen for 3 payments of $79.99. And welcome back to the JJ Show. Now let's get back to that interview. So, it is evident that being recently diagnosed with type 1 diabetes can be very hard and life-changing for people. How can having type 1 diabetes affect family, friends, your job, or your school?
Well, family and friends are always helpful to talk to, especially to cope with situations like that. I mean, as when it comes to diets or something, you may not be able to drink as much alcohol or eat as much pizza as you'd like with your friends, but they should always be there and understanding about it. You have to take time out of your day, whether it's during school or work, hopefully before or after, but to inject insulin, of course. You should always tell family members, friends, and maybe one or two or more coworkers at work about it, because something bad happens to you at work or school. That way, people know what's wrong and can help you through that.
And lastly, being diagnosed with type 1 diabetes can be very stressful. How can you help your patient to cope with it?
Well, like I said, family and friends are always there. As a dietitian, I'm very familiar with the matter that people have very much trouble coping with it. I find that my clients are very nervous in the beginning, but are quick to adjust, that talking to me does not cause them discomfort anymore after a while. I'm always free to answer their questions, like I stated before, and give them advice or suggestions. It's very important to understand that many go through these very same instances and procedures, and some may have it better, some may have it worse. You never know. I always make it my priority to make sure my clients recognize that they are not alone, and there is always somebody who knows what you're going through and can understand. And that's really how you cope. Coping is a very big issue among my patients, but there's always someone there to help.
Always. And that concludes today's show with JJ and
Dr.
JJ.
Jill and
JJ.
me.
Okay, for any of you doubting that Dr. Spriesterbach is not a real licensed nutritionist, well, we got her license right here, boy. Let's go. Look at that. It's all backwards, but, you guys get the gist. Pickles and popcorn. Oh, welcome to Knowledge is Power, JJ,
And
directed by...
Dr. Jill.
Stop.
Show started.
We're rolling?
We're rolling.
Welcome back. This blooper reel. Get yourself a red pen. These things are amazing. Like, it marks.
Michael, sing
I
it.
know when that hotline bling. That can only mean one thing.
It's so remorseful. You're gonna make me cry, man.
I know. It's beautiful. Hey, y'all. Hey. Just don't get along. You made